Welcome to day 8 of Alan's keynotes study streak. And the remedy which we will discuss today is silicea. Now, this is almost similar to the remedy that we discussed yesterday or in the previous session, which was sanicula. Similar, I say, because some traits are common, and when you learn a remedy in commonality in an extension of the previous remedy, you have more chances to remember it rather than reading it alphabetically. So let's proceed. And the first line what is written in Allen's keynotes for silicea is ailments caused by suppressed foot sweat. Cuprum, graphitis, sorinum are the other three remedies mentioned. It is very difficult to elicit this symptom, but when you ask the patients, they will tell you that I used to have a lot of sweating earlier, and since the last few days or last few months, depending upon the acute or chronicity of the complaints, I'm having very less perspiration. And where they used to have, when we asked, we get to know it was only in the foot. So in that way, we will be able to locate this symptom and give the remedy silica. Further, what Allen writes in the silica remedy is that ailments from exposing the head or the back to any slightest draft of air. So you see that every part is so sensitive that even if it is exposed even slightly, it causes an aggravation or it causes some minor or major problems. Now, why is back mentioned? If you ponder over this point, you will understand that children are usually carried with the back facing outside, and if they are not covered properly, if they are wearing very thin sheet of cloth, then you will see that this has affected them later on in their in their complaints. So you will see that this is very strongly seen, and if the head as well as or the back is uncovered, it causes problem. There is ailments also from bad effects of vaccination, especially if there have been abscesses or convulsions because of the vaccination. The another remedy is thuja. Chest complaints of stone cutters, those who make those idols, with total loss of strength. Going further, we see in Allen's keynotes for silica, it's day 8 today, and we see an interesting mention about adapted to nervous, irritable, sanguine temperament, persons of psoriatic diathesis, persons of light complexion, fine, dry skin, pale face, weakly with lax muscles, constitutions which suffer from deficient nutrition, not because food is lacking in quality or quantity, but from imperfect assimilation. The two remedies mentioned in the brackets are Baraita carb and Calcarea carb. Oversensitive physically and mentally. So you see these patients, especially these parents who come to you and they tell you that the child is not putting on the weight in spite of giving all the necessary vegetables in food, fruits in the food, and all the necessary nutrients. There is a kind of an imperfect assimilation from the gastric intestines itself, which causes an imperfect development of the child, imperfect development of the body, and that is where we should think of silica. The other two remedies are Baraita carb and Calcarea carb. The constitution was also mentioned. Going further, we see scrofulous, rachitic children with large heads, open fontanelles and sutures, much sweating about the head. There is an interesting thing mentioned in comparison to Calcarea carb, and that is lower than Calcarea carb. Okay, so there is a symptom which is mentioned much sweating about the head and lower than Calcarea carb. So how will you know it is more, it is less? When you will see a perspiration of silica, when you will see the perspiration of Calcarea carb, and you will see that the more wetter will more indicate silica and the lesser will indicate the, sorry, it's the reverse, the more severe is Calcarea carb, and so it's much sweating about the head lower than Calcarea carb. So much severe will be Calcarea carb and less severe will be lesser perspiration on the head will be silica. So these are very subtle things. If you pick them up in your practice, if you see maybe 10, 15, 20, 30 cases of sweating of head, you will realize how important this symptom becomes. Especially silica will have perspiration on the part lanon, just like we saw in sanicula. And then further it is mentioned that which must be kept warm by external covering, like sanicula. Distended abdomen, weak ankles, slow in learning to walk. Children are obstinate, headstrong, cry when spoken kindly to. The other remedy mentioned is iodine. Now we saw a similar thing in antimcrude as well. And what was mentioned in antimcrude was angry at every little attention. Go back to antimcrude, and when you will see antimcrude, you will see that it's mentioned that it's having angry at every little attention. So even if you see the child, it will start crying. Here it is mentioned that cry when kindly spoken to. So when you will try to converse with the child, when you will ask something to the child, it will the child will try to give a reaction, or they will cry, or they will throw a fit or something like that. That is where we should think of silica. Going further, we have restless, fidgety, starts at least noise, anxious, yielding, faint-hearted, mental labor very difficult, reading, writing, fatigue, cannot bear to think. Now this is almost similar to the natrum elements which we read. All the natrum elements had some or the other inability to think, inability to comprehend. That is what is there in silica also. Although silica is much more deeper, we will see this if we study the other materia medicas. It cannot bear to think at all. That is what is mentioned. Those are the specific lines. Great weariness and debility, wants to lie down. Nervous debility, exhaustion with erythism from hard work and close confinement may be overcome by force of will. So it's not that it cannot do the work, it's not that it's so weak. It can do some work, but it needs the force of will. And if the will is strong, silica can achieve what it wants to achieve. Want of vital heat, always chilly, even when taking active exercise, just like ledum and sepia. Has a wonderful control over the suppurative processes, soft tissue, periosteum or bone maturing abscesses when desired, or reducing excessive suppuration if there are abscesses, especially in the soft tissues. Okay, now whether it is there in the bony places, whether it is there in the soft tissues, whether it is there in the deep tissues, if you try to find out from our materia medica the different locations where abscesses are located, the remedies will change. And what you will see for silica, it is mostly in the soft tissue or periosteum or bone maturing abscesses, and it will try to reduce the excessive suppuration or pus formation which is happening or which may happen in the long run. If it affects only the soft tissues, only and only the soft tissues, think about calendula and hepar. These are the two remedies mentioned. The next symptom what is mentioned is night walking. Classically in medicine textbooks it's mentioned as somnambulism. So in most of the other materia medicas you will have this word which is mentioned, somnambulism. Gets up while asleep, walks about and lies down again. So they don't know what's happening to them. It's just a sleepwalking phenomena, just like Kali Broom. Takes cold from exposure of feet, conayam and cuprum are the other two remedies mentioned. Sweat of the hands, toes, feet and axillae. So you can see that sweat, especially on the covered parts or parts which are lying down, that will predispose to giving silica. And they are offensive. That is the bold letters of Allen which is mentioned in his keynotes for silica. Intolerable sour carrion like odor of the feet without perspiration every evening. So even if there is perspiration, even if there is no perspiration, the smell always remains. And if we try to corroborate this from the patient, from the relatives, we will be able to pick up this very important physical general and prescribe silica. Desire to be magnetized, which ameliorates, just like phosphorus. Promotes expulsion of foreign bodies from the tissues, fish bones, needles, bone splinters. The other remedy which we know from Boric Medina Medica is Enagelis. This is just my addition, it's not mentioned in Ellen's keynotes. Going further, we have vertigo, spinal ascending from the back of the neck as if one would fall forward. Okay, so vertigo is a very difficult condition to treat. If you have seen patients in your clinic, or if you have seen patients in your wherever you are studying, it's a very tough to deal with such patients unless you know how to pick up those little subtle things and ask them whether they fall to forward, right side, left side, and what is the vague feeling in their head that they feel when they have vertigo. Silicea will have something that begins from the nape of the neck to the head, and also it has a very peculiar headache which is also settling on the right eye. So about the vertigo, first it's about that they will fall forward or from looking upwards, and this is similar to pulsatilla, and pulsatilla and silica we know that they are related, acute and chronic. If they feel vertigo when they are looking down, it is scalmia and spigelia. Then we have chronic sick headache, which is since some severe disease of the youth. So since the time they had some bad disease from the youth times, they have these issues, just like sorinum, again ascending from the nape of the neck to the vertex, as if coming from the spine and locating in one eye, which is the right side. And if it is in the left side, left eye, it is spigelia. Spigelia is more predisposition to the left side. Silicea will have aggravation from draft of air and also uncovering the head, feeling better by pressure and wrapping up warmly. This is similar to Magmure and strontium curve. Also, it will have better by profuse urination, just like we see in Gelsemium and to some extent in Sanguinaria. Now, there is a very interesting thing mentioned about the glandular system, which is inflammation and swelling and suppuration of glands, cervical, axillary, parotid, mammary, inguinal, sebaceous, malignant, gangrenous. So you have a patient with the pathology that there is swelling in the glands, there is kind of an inflammation, suppurative process, or ahead of suppurative process, something which is malignant. Think of silicea. Constipation before and during menses. So these are the physical generals which have been mentioned by Ellen, and if you know and if you keep in mind these physical generals, it becomes very easy for you to just ask these physical generals as a confirmatory symptom to patients and decide your remedy. That is why Ellen's keynotes is important. It will not only give you the keynote of the medicine, the general feature of the medicine, but it will also help you decide on which remedy to give based upon the physical generals which he has mentioned, which are very, very, very strong. If there is diarrhea before or during menses, think about ammonium carb and Bovista. If it is constipation, think about silica. The constipation is as from inactivity of the rectum with great straining, as if rectum was paralyzed, and it partly is expelled and it is receded again, just like we saw in Sanicula. And the remedy mentioned over here is also Thuja. It is also there in Magmure. So you read these remedies in some other area of Allen's, and then you apply them when you read the another remedy. That is the beauty of Allen's keynotes, and homeopathy is just as simple as it can be. The next symptom what is mentioned in Allen for silica is feces remain long time in the rectum. Fistula in ano alternates with chest symptoms. Now, many times patients will come to you with one complaint, but when we locate or trace their history, how it started, it may have started with some other complaint. It also can be a way of eliciting alternating symptoms. So if the patient presents to you with chest symptoms and few days ago he had some fistulous process, especially in the anal region or anywhere else in the body, think about silica. He may present to you with fistula in ano, and few days ago he may have had gastric distress or chest trouble. It's kind of a alternating symptom again. And the similar remedies indicated over here are berberis and calcarea phos. Fissura ani, great pain after stool. Discharge of blood from vagina every time the child takes the breast. Compare remedy mentioned is croton tick. Now croton tick is a remedy we will always think of diarrhea and gastric troubles, but it is mentioned over here, so you need to keep in mind. Nipple is drawn in like a funnel. Sarsaparilla is the remedy mentioned. This is a very subjective symptom. You may need to ask if you need to ask in certain cases of breast pathology, or else the patient may even tell themselves. Coming to an end, we see that there is unhealthy skin. Every little injury separates. We know that this is there in graphitis, hepar, mug salt, and petroleum. In fact, I would say it's also there in kind of some cases of psoriasis also. Crippled nails on fingers and toes, antimicrobial is the remedy. Fistula lacrimalis, ingrowing toenails, macphos, and Tiprim marum are the remedies mentioned. There are a lot of things mentioned for this particular symptom of ingrowing toenails and fistula lacrimalis. There is panericium or something related to nails, also blood boils, carbuncles, ulcers of all kinds, fistulae, painful, offensive, high spongy edges, proud flesh in them. Now coming to an end, we see that there is aggravation from cold during menses, during new moon, uncovering, especially the head and lying down. And amelioration we have is especially from warmth, from wrapping them up, especially the head, and all the symptoms are better by cold food except the gastric symptoms. Also, the other remedy is mentioned as lyco. We will discuss this in lycopodium when we come to this remedy. Silicea is very much complementary or very much close to thuja and sanicula, as I told you in the beginning also. So if you have read this remedy earlier, the sanicula remedy, and then you come to silica or vice versa, it will strike you more clearly about the different aspects and the common aspects, and then you will be able to pick up the same from your clinic. So that is what a homeopath should do: compare and differ the different remedies, and then you should proceed rather than reading it in an alphabetical way. You can also see that there is a comparison of hepar, picric acid, califos, hypericum, ruta, sanicula, and Gettysburg, which is water, a kind of a special water. We'll discuss this in Boric or Clark. And silicea also follows well calcarea carb, graphitis, hepar, nitric acid, and phosphorus. Silicea is followed well by again hepar, fluoric acid, lycopodium, and sepia. And as we know, silica is a chronic of pulsatilla. This is what is the last line mentioned. So I hope these sessions are kind of helping you understand the different relations of the remedies that we are discussing. And it is important that if we do it this way, it makes our job to understand the remedies in a very easier way. That's what homeopathy is all about. So thank you all for joining, and see you all tomorrow with a new remedy which is a relative of all the remedies that we discussed or has some traces of it.